Okay, in this video, I'm going to talk about one major reason for low back pain. Low back pain is one of the most common ailments and actually the second most common reason for doctor's visits, right behind respiratory issues like colds and flus. So it's pretty prevalent. A lot of people have low back pain, discomfort, and often seek many professionals with no answer. Now, I'm going to give you one very common reason why people's low backs are in bad shape. But keep in mind, this is not the only reason. Human body is very complex and there is a lot of possible reasons why we have aches and pains. So this is one out of many possible reasons, but it is a very common one. And it is one that you often will see associated with disc issues, especially, maybe a little bit of disc protrusion in the lower back. And I'm going to bring out my favorite app again, Complete Anatomy 2, show you your skeleton. So this is your lumbar spine. When you hear people talk about a diagnosis like I've got a disc issue in my L4, L5, L is just pertaining to a lumbar. That's the region of your spine. 4, 5, there's 5 vertebrae in the lumbar region, L1, 2, 3, 4, 5. So that's what the numbers correspond to when you hear people talk about discs and L1, 2, 3, 4, 5. Now, what often happens is that if you've watched my last video, you'll remember how the pelvis will find itself in a forwardly tilted position. Now this, let me turn that off. This doesn't have the pelvis on it, but just know the pelvis sits here. This is your tailbone, this is the back of the pelvis. But what will happen when a pelvis is tilted forward, which means it's coming forward this way, it will basically shorten this space right here in the back because the pelvis is tilting forward. Gotta stop touching that. It's gonna, because of its muscular attachments, going to pull the lumbar spine forward with it. So it's going to create a lot of compression back here where the discs, you can see these little spaces right here, these are where your discs are. So what happens is it gets kind of squished in the front. So this little space right here starts to close down. The disc is like a jelly-like structure, and it will sometimes push forward because that gel in the disc has to go somewhere. It's like pinching a balloon. If you pinch one end of the balloon, the backside is going to get bigger. So this side, the disc will protrude posteriorly or towards the back. And that's why you often see, if you go get an MRI or an X-ray, you'll see the discs are protruding back there because the lumbar spine, again, is very curved forward because it's being pulled forward. Now, again, I'm not going to get into solutions with this video because it would go for 15 minutes, but if you're one of the many people that has low back pain or discomfort, even if that image shows a disc issue, just remember that there probably is also a positional and muscular problem going along with it. So, you may need some medical intervention to get that disc back into place, but you also most definitely will need some neuromuscular repositioning and re-education to get your pelvis and low back and all the muscles around there to function properly so that you can have more space in those vertebrae so those discs, again, won't get pinched anymore. So if you have questions on this, I know this is complicated and this affects a lot of people, but again, it's a common issue that people come to me and see, and I want to get some of this information out because sometimes you're not going to get this from a medical professional because they're very rushed or they just don't have enough time to sit and explain this stuff to you, but there are solutions out there, and sometimes they're not as invasive or complicated as we're led to believe. So again, if you got comments on this or questions, you can question on this video and I'll do my best to answer them. Just keep in mind, I'm not a medical professional, so I can't give you any medical advice, but if I can direct you somewhere, or if you'd like to work with me personally, cool, if you're in the Houston area. But that's it for this video. I will see you in the next one.